Hi guys, I'm here again with Dr. Bock, CEO of Colorado Mountain Medical. And this week, this community all received very, very tragic news of a young man in this community that lost his life due to the coronavirus. So I wanted to have Dr. Bock on here to talk a little bit about how severe of an illness this is and what you should be doing at home if you are infected and know you're infected or maybe potentially affected and are getting sick at home. Can you tell us a little bit about this disease?
Of course, I'd be happy to. And the coronavirus, COVID-19, is a very deadly virus. And the statistics that we know of from other countries who have experienced this, and they're similar in our own country, is that about 80% of patients are going to have a mild to moderate course. About 15% are going to have a more severe course, and then 5% are going to have a very critical course. And we're seeing similar things in our own community. We've had now our second death of an Eagle County resident, and that's a tragedy that we all mourn. The symptoms that are important to recognize are quite broad at this point in time. We have patients who have what you've heard about, I'm sure, on the news and for quite a period of time, folks with fever, with a dry cough, with shortness of breath, but it's expanded to include headache, body aches, earache, sore throat, loss of the sense of smell or taste, sometimes abdominal pain, nausea, vomiting, diarrhea. All of those are now recognized symptoms. So we want those patients with those types of things to go for testing. The course of this illness is different than many other illnesses we typically deal with. And what I mean by that is that for particularly those people who are in the critical or severe category, the first 4 to 5 days may be relatively benign, or you may feel pretty sick, but sometime for a certain subset of our population, and it's not clear what that subset is. It's certainly the more elderly, people who have other illnesses, but it's also impacted people who are not elderly and do not have other serious illnesses. And so that group of people, sometime around the 4th or 5th day, maybe as long as the 8th or 9th day of their being symptomatic, all of a sudden develop much more respiratory distress. It's difficult for them to take a deep breath and feel like they're getting enough air. And if their oxygen saturation were to be measured, we'd find it to be low. And that progresses very quickly, sometimes from a matter of minutes to maybe a couple of hours, to a point where someone is needing to be intubated, a tube placed into their airway and placed on a ventilator. These are life-threatening moments in time. And so if you are at home, either having tested positive for COVID-19, or if you're at home awaiting a test result, and you find that suddenly you don't feel you can breathe normally, and it's a pretty profound impact, that means that's a time when you need to seek help. You need to get yourself to one of our respiratory clinics. You need to call 911 and get an ambulance to transport you and get help, so that we can do the things that will get you supplemental oxygen, and hopefully over time your lungs will be able to restore. Because what's happening at that point in time, if you've developed almost certainly a viral pneumonia, many times in both lungs, and it's significant, and it's something that is not going to go away quickly.
So what I'm hearing, Dr. Bock, is one, if you're sick and it's progressively getting worse and you have shortness of breath, you need to contact your medical provider.
Absolutely.
Right?
And if it's the nighttime,
Yep.
The only place you're going to be able to contact is the emergency department, because that's the place that's open 24/7. So you're going to have to dial 911 and get yourself help.
And two, while the data shows this primarily really impacts the older population or immunocompromised folks, what we're seeing, and unfortunately have seen here in this community, it could really be anybody. So we all need to take this very seriously.
That's absolutely the case. And it's a devastating illness, and we need to pay attention to ourselves and to our family members and get help early on.
Thank you.